Good morning.
Morning. We'll open the Kaneohe County Health and Human Services Committee. And before we get into the presentations of the day, we got a little business to take care of. First of all, the minutes of the February 16th meeting were sent around to you. So I would entertain a motion to approve the minutes. Commissioner?
Yeah, go ahead.
Oh, you were first. I'll second it.
Okay.
Commissioner Nissen moves, Commissioner Berg seconds. Any discussions? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Then we have some bills to pay. You were also sent that in your packet.
Yep, they're right there.
Commissioner Gardner moves on the bills. Do I hear a second?
I'll second that.
Commissioner Anderson seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. And then there were two requests for cancellation on the warrants. The wrong amounts were made out, so we need to move on canceling those warrants.
I'll move that we.
Commissioner Anderson moves on canceling the warrants. Do I hear a second?
Second.
Commissioner Nissen seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Thank you. All right. I assume being she stepped to the podium that Tammy Jo is up next. And I don't have my agenda open here, but I will in a second. Go ahead, Tammy.
Okay, good morning.
Good morning.
Tammy Jo Lieberg, Director of Community Corrections. Last month, I talked to you a little bit about, what community corrections meant. This month, I wanted to come back and talk to you about what we do at community corrections and some of a little bit more in detail. And then in the future, we'll go in and I'll have some of my staff come in and talk about more details on each little level. But I'm going to give you kind of an overview today of what we do at community corrections. So if I can I don't know, can you guys see my PowerPoint?
Nope.
I don't think. Switch it over.
That's what it's showing that, so,
See if it's coming up.
yeah, that's what I was just on.
Always a technical difficulty this
And
time.
you even came in early to make sure
I
this didn't
know.
happen.
Can you press play, like go through, or
Yep.
is it on?
It's on up here.
Okay.
It is always something.
Hey, Ray, can you hear us? Come on in if you can hear us.
I'm coming
If I just touch it, just something happens, right? All I have to do is have something, just have anything to do with it, even when we're ahead of time. So,
Makes me feel
Technology.
better when somebody else has trouble with computers. So,
we'll get it.
yeah.
I don't want to get too far ahead like I did last time and then I get all out of order. What did I do to it this
So
time?
that's that.
What in the?
Now you're cooking with grease.
That's the only thing. It's still kind of weird that it's showing off the podium.
Yeah, that's that camera there, but sometimes this gets unplugged on.
There we got it.
There.
Oh, they're all set.
There you go.
Thank you. Okay, start again. So we'll go over through an overview of community corrections. So the main thing that we always are looking for is that long-term public safety. By utilizing supervision practices, rehabilitation, accountability, and managing our resources at the local level, we are trying to adjust and deal with the different types of people in our communities that have been sentenced to probation, supervised release, or some community work service programs as part of our programs. I've talked about it before. I always start with bringing in our mission statement and our vision statement. I probably won't go through it all the way through it today, but just to make sure that everybody remembers that, our overall goal is to promote public safety at the local level. So we're reducing recidivism, reduces social and financial costs to our communities. When we're talking about, it reduces victims, it improves the lives of the offenders that we work with on juveniles and adults. And it gives us the ability to give back to the community using restorative justice processes that we have. So we start this process all the way at the beginning, at the pretrial stage. So my staff come in and start with the bail evaluations every morning, Monday through Friday. We have to have those bail evaluations to the court by 10 a.m. And we don't necessarily know what's going to come in the morning. So if 10 people were arrested last night, we might have 10 bail evaluations to do. If there's none, we don't have any. So we kind of have to plan in advance as much as we can. This is one of the areas that I always say probation is not an 8 to 4:30 job. This is one of the reasons it's not, because if we waited till 8 o'clock to get these things started, we would never get them done in time for court. So I have staff that when they're assigned to bail evaluations, they check their computers early in the morning, and sometimes they're here at the office by 6 a.m. to start those evaluations. As part of that process, they look at the jail roster to see who was arrested overnight. If they qualify for a bail evaluation at the time, they determining the severity level of the offense, they start running criminal histories, which are not only our local criminal histories, but nationwide criminal histories through our computer systems. And then they put all that information together in a report for the court. They also make recommendations to the court on what those pretrial conditions might be. Now, we're always looking at a pretrial conditions as a presumption of innocence. We can't really go into too many details, but as we at the same time, we have to provide community safety through supervision. So we're really looking at how do we keep people safe. Sometimes that might be drug and alcohol conditions.
Yeah, I just have a question. When you look at the jail list, how do you determine which agent is going to grab that particular case, or do you have somebody assigned every morning?
We have 2 people assigned every morning and then usually a backup, actually, just because it's one of those things that we can't, if we have to wait till 6 o'clock in the morning, it's kind of tough to decide. So we have our probation agents of the day. We do a rotation right now that includes actually myself, which is funny, me trying to do a bail eval, but we start early and everybody's assigned on the rotation every single, for each day that we need it. We also so part of that process is notifying the court of any changes, reminding the individuals of their court dates, because the whole goal of a pretrial supervision process actually is to get them back to court without committing new crimes. So those are the 2 primary focuses, is when is their court dates, and what can we do to make sure that they're not committing new crimes while they're pending sentence. We monitor their court conditions. That might include drug testing or alcohol testing. It might mean that they're under some type of GPS or electronic monitoring or house arrest. But we're really trying to keep, especially during COVID, we've been trying to work very closely with the jail to make sure that we have as few people in the jail as possible during their pretrial status. We know that if somebody's in jail, they're more likely for conviction or different other problems, so it's really important for us to get them out in the community. We're also starting, actually in March here, a new pretrial program where we're providing a voluntary case planning process. We looked at really what was happening during COVID, and we have so many cases that are sitting in this pretrial area. Some of those cases longer than what we have in the past, seen in the past, of like they've been in pretrial status for over a year because of the backlog at the court system. That's really a period of time where we don't want people to not be able to work on rehabilitative things. It's kind of stagnant time. And so we've started a program now where we can provide case planning for those individuals on a voluntary basis. We won't get into any of the details of the crime. We're not going to get into any of the details of different things that would affect them when they do go to court. But we also want to make sure that we provide services so that if they want to make changes in their life ahead of time, before that court process, that we can. So hopefully we're also doing a little bit of statistics, and hopefully we can bring that forward and show that we can make a difference during in the next year with that pretrial caseload. So part of going to that, my staff is I have several staff that work on that pretrial unit that are doing bail evals, they're doing intakes, they're watching these cases as they come through. The next piece of it is our pre-sentence investigations. Pre-sentence investigations are very in-depth reports that we provide for the court at the level between a plea agreement or a trial that goes into sentencing. We do a pre-sentence investigation is for the adult side, but we also have, I'll talk in a minute about what we do with juvenile cases as well. So the pre-sentence investigation is completed when the court orders it on misdemeanor through felony offenses. We do an in-depth dive into that criminal history. We have to look and see how many types of offenses, either locally or at a national level, somebody may have. This becomes pretty complicated because as much as we have worked towards a single system over time in criminal histories, reality of it is some people report criminal offending differently, right? When we talk about it on a local level, we go county to county, we may see changes. Nationally, we're really looking at from state to state. And so we have to be able to translate what this offense means in Texas compared to what it means in Minnesota before we can actually identify what's going on. We complete a victim impact statement. Many offenses require by statute that we complete a victim impact statement, or even a neighborhood impact statement if you're looking at drug sales. So the probation officer works either with the Victims Assistance Office, or they go out and collect that information themselves, taking a verbal or written statement. We look at the personal and family history of each individual. That goes looking at from where they were born, where they grew up, what their family life was like, if they're married, how many kids they have, all of the different details involved in their life that could make a difference, and what we're looking at for both positive and negative influences in their life. We look at chemical dependency and mental health, because both of these could have an impact on how their what we call responsivity issues come into play when we're dealing with the needs of the individual. We look at jail credits, and that's another one of those things that you think sounds really simple, but actually the probation officer has to go in and look at all of the jail credit that somebody may have had, especially during a period of time like COVID, when we have people out for a long period of time pre-trial status. If they served any time in the state of Minnesota while their offenses were pending, they get credit for it. So it actually has to go back, and they have to look at all jails in the state of Minnesota. If for some reason they were in another state jail, we have to actually include that information, but it's up to the judge whether they received the credit for that jail time. And then we look at risk assessments and what that means. So for a general caseload, we use what's called the level of service inventory revised and case planning, that we address the risk of the individual and then identify the needs. And I'll talk about that a little bit more as we go forward. We also have domestic abuse assessments. We have sex offender assessments. We have gender responsive assessments that look at, because we know males and females commit crimes for different reasons. We look at what's going on in those individuals' life so that we can appropriately identify what needs to happen to make changes in their life. So we include all of that information together in a report, and it might be 3 pages if the individual doesn't have a lot of time, or it might be 30 pages depending on what's going on in their lives and their history. It's very extensive, and that all is provided to the court before they go in for sentencing. As part of that, we also have to include Minnesota Sentencing Guidelines worksheets. What those are is we take the severity level of the offense and their criminal history and put it into a grid and create a number of months. Because Minnesota is a truth in sentencing state, we have to provide how many months that individual would have to serve in prison if they were sent to prison, to the court and to the individual. it's two, and then how much times 2/3 and 1/3 is what we look at. So if they are sentenced, for example, to a stay of execution for 18 months, is an easy number to use, 2/3 of that time would be served in prison and 1/3 would be on supervised release. That's what most people think of as parole, but because we don't have parole boards in Minnesota, it's called supervised release. All of that is provided to the court ahead of time so that they can hand down the sentence. It's pretty complicated. The sentencing guidelines book, I always joke about the fact that it's about 350 pages and it changes every year. Every August 1st, we have to update it. And we have to go back and look at, depending on the year the offense was committed. So it's really critical that my staff stay up to date on statutes, on case law, and understanding of what's going on with that process before they make those recommendations to the court. On the juvenile side, it gets a little more complicated. Yes, sir.
Before you move on to juvenile, I just wanted to give the commission committee a chance to ask questions if there was any questions on what you've presented so far. Commissioner Gardner?
Thank you, Mr. Chair. Tammy Jo, you mentioned the new voluntary pretrial program.
Yes, sir.
Excuse me. Can we assume that it's one of the goals of this is also to help empty the backlog of cases that have been caused by COVID, or not intentionally so?
No, it won't. Hopefully it might, I suppose, on the other side, help people get through the system faster once they're on probation. One of the things that we look at with probation sentences is the less time they actually stay in the system, the better off individuals are. So if we get them to work through their case plans and make changes in their life before they even get to that, we may see them less on the backside on the probation side. So that is a goal overall. But what we do on pretrial probably wouldn't really affect the trial process. That's more of a legal aspect.
Sure.
What we work with is the individual.
Mm-hmm.
So.
All right. Then I won't ask my follow-up. Thank you.
Okay.
I have one
Commissioner
question.
Anderson.
Do you guys have like a computer program that you plug some of this in, or is it mostly gut feeling, or is it, or do you follow like a chart, or for guidelines for like, how to do a bond and set that, or is it?
So yes, we have a computer program and we have a book. And with some of it's not gut. In Minnesota, we have very, very strict guidelines in terms of if you commit this offense with this statute, it's going to be listed at this severity level. We have a grid that we have to go in and we look at very closely. And so it's very specific, but that's why they have to really have a good understanding of the statutes and which offenses fit in. So like for the bail study, one of the reasons that gets complicated, kind of going back to that, is not only we start that criminal history process and we kind of figure out what they've been charged with, but all the way up to like 9 o'clock when the county attorney files their paperwork, that change, that offense level could change, and we have to be ready to change that as quickly as it comes in and then submit it to the court.
Okay.
Any other questions? I have one. So when you answered Commissioner Anderson's question regarding gut feeling versus, guidelines that are pretty straightforward, it seems to be fairly obvious that sentencing is somewhat discriminatory amongst different groups across the state, not just in Minnesota, but all over. So with that fairly objective process, how can that happen? Is that people like in corrections, or is that the courts that are causing that?
So we're going to go back into a little bit of history, but Minnesota established this Minnesota sentencing guidelines in 1983. One of the original goals for the Minnesota sentencing guidelines was to reduce disparities, right? So that if you commit the same crime and you have the same criminal history, it doesn't matter if you're male, female, the color of your skin, whatever you're looking at, you're going to have the same sentence as somebody who committed the same sentence next to you. One of the areas that we've found over history, though, that can still have an impact on disparities is the arrest rates and the idea of the fact that even our criminal history rates. So like when I'm using a grid, this guideline sentence that says whatever your criminal history is and the severity level of your offenses is going to have the same offense. If your criminal history is larger because you've had more sentences, you've had more arrests because of disparate reasons, or didn't have the assistance in the court system, or all of the different things that go into the criminal justice system, it can still create those disparities across the board. It actually almost solidifies them a little bit more. The problem is we don't really have a better system right now. I mean, if we have guidelines and we're going as close as we can to that. Other pieces of the criminal justice system, you know, from arrest rate to what you're prosecuted at can make a difference. So I don't know if that answers your question, but at least kind of gives you a little bit of background.
You're talking about arrest versus, you know, because sometimes that disparity is in the actual arrest.
Right.
Not in the sentencing.
Or it could be where, if you look at some of the data, it's not just the sentencing or the arrest date, it's where you live. It could be poverty issues. It can be living in a higher crime rate area can have an impact on what your criminal history has. So that's why even today we see so many different problems, because there's so many different pieces that go into this.
All right. Thank you for taking the time to answer those questions.
Okay. Okay, so we'll go in, and actually, I'm going to talk about juvenile stuff, which juvenile supervision in our predispositional reports. And I'll tell you that also has a significant impact on what you're talking about. Because we know that the minute somebody's in our criminal justice system, the more likely they are to stay. The highest risk factor for a juvenile is actually just being in the system. And when I talk to different groups about this, I think about the fact that when you were a kid, don't raise your hand, don't do anything, but how many times did you get in trouble when you were a kid and you didn't get caught? What the difference between a lot of us versus our next door neighbor is one got caught and one didn't. And once you're in the system, it can make a very big difference. So over the years, and you'll see it in my juvenile numbers when I get to those, is we've understood this. We try very hard to get juveniles in and out of the system and put as little of the system into their world as possible. But that doesn't mean that there isn't kids that don't need assistance, that don't need some type of accountability. So we're trying to use as few services as possible on the front end if we can, and then kind of move forwards. As part of that, we have 3 different levels in the juvenile system. And this is where I said the juvenile system is a little bit more complicated at the pre-sentence level. Our pre-sentence predispositional reports include many of the same things I talked about on the adult side. But we also have 2 things added in: the extended juvenile jurisdiction and certification studies. And what that means is for a juvenile, we want to get them in and out of the system as quickly as possible. But sometimes they commit offenses that are a lot more than we can handle in our juvenile system today. And so we have the option of not just juvenile probation, but we have extended juvenile supervision, which puts their cases up to the age of 21, but keeps them in the juvenile system. The complicated part of this is at that point, they also have an adult sentence hanging behind them. So if they violate their conditions, or if they have problems while they're on probation, they actually get an adult sentence instead of a juvenile sentence. So it's the way the state has really blended the 2 sentences to make sure that we still hold kids accountable that need to be held accountable for serious crimes, but we still give them the benefit of the doubt if we can, in terms of correcting things before they go into adulthood and not having a criminal record, because that criminal record really has an impact on what happens. And saddling a kid with that at the age of 16 or 17 really kind of sets the stage for future problems. We also have certification studies where my juvenile probation officers make recommendations on really serious offenses on whether or not an individual should actually just automatically go into adult court. A lot of times people think juveniles get the soft end of the correctional system, and I would tell you that it's actually a misnomer. It's like a myth. People don't understand that a lot of times juveniles actually have more expectations put on them, and they have more serious consequences. So if we think about the idea that at the age of 14, if you make a mistake, that it can be held against you for the rest of your life, it's pretty important that we give these kids that opportunity to make changes and change things going forward. We know that the brain isn't really an adult until the age of 25. So anything we can do to help kids make those changes and not have an impact on them is a really positive thing. So that's kind of the intake, like the pre-trial process, and then I'm going to go into probation supervision. So I don't know if anybody has any, as we kind of switch over. No? So when we talk about probation, I'm going to talk about the different levels here. So once they're sentenced, right now we've talked about bail studies, pretrial supervision, the reports that we complete for the court in providing sentencing recommendations, and then we go into probation supervision. So that's the next stage. Now an individual has gone to court. They've been given a probation sentence and a probation officer. We have a risk level. We know a little bit about them from that pre-sentence investigation, and we're trying to find out how do we help that individual make changes in their life. One of the biggest things that we have to look at this point is how do we address that through accountability and rehabilitation. We know through research and evidence-based practices the quickest and easiest way to address this is through swift and certain and celerity. We're talking about immediate consequences, right? We're all humans, and just like going all the way back to Pavlov's dogs is the idea of the fact that immediate consequences or rewards are what makes the biggest difference. Certainty, the idea that all the way back to the early corrections and law enforcement time, we talk about if we don't think we're going to get in trouble, it's not going to make a difference to us. Right? So we have to have certainty involved as part of the process. And then celerity. If we go back to the idea of way back into history and we start chopping people's hands off, we're not going to really have any impact either because our punishments are so severe compared to what the actual offense is. So it's proportionate, it's swift, and it's certain. That's what probation provides by providing somebody who's looking over somebody while they're under supervision. And so we know the individuals a little bit better. We know what the needs that they have are, and then we provide more specific supervision. Probation is not easy. Anytime that anybody thinks that probation is a soft side either, it's not easy. That means that an individual could be told to do a drug test at any point. They can have their probation officer walk into their house and walk through their house at any point. We can do a search without a search warrant. There's lots of things that happen on probation that as a general citizen, most people would not be faced with. And so those are the tools those probation officers are using to provide that public safety. But then on the backside, then we have to look at the rehabilitation side. So, public safety, accountability, and rehabilitation. We're looking at court-ordered conditions. In some ways, these are the least likely things my probation officers are doing right now, right? The court-ordered conditions, the alcohol and drug testing, monitoring compliance like address, appointments, fines, transfers. Searches, the idea that if we know somebody's doing something illegal, that we have the ability to go in and we don't have to go get a search warrant while somebody's under probation. Their rights under probation are less than a general person in the community. And we can do warrants or an apprehension and detention order. The probation officer can do an arrest on site if they feel that there's a public safety issue, or we can request a warrant from the judge that can go nationwide. So we're doing that supervision, trying to make sure that we address public safety, but on the other side of it, we also have to address that long-term community safety piece. We got to look at how do we make changes for that individual so that they're not committing crimes in the future. We use evidence-based practices to do that, and I'll just kind of go through a little bit of what we do under those things. I talked a little bit about our risk and needs assessments and then developing a case plan. We are addressing the needs of the individual. We use motivational interviewing, trying to provide some of that internal motivation. We do a lot of crisis counseling. I mean, when we talk about our days, that's what a probation officer's day could go from. In the morning, we have one crazy thing happening, and the next thing it's another crazy thing happening. I will tell you that yesterday I had a probation officer dealing with a suicidal individual, all the way to a probation officer who was dealing with somebody moving across the country. We have things that happen. We're dealing with human beings, and it's something that they have to be ready to deal with and it changes very quickly. Things you don't know. They work on cognitive behavioral programs, employment, education, and housing concerns, and we do referrals to chemical dependency treatment and mental health counseling. So my staff are trained in doing motivational interviewing and cognitive behavioral programming on a direct or a group level, but there are times that we still have to refer out. We're not, to chemical dependency treatment or different types of mental health counseling. Yes, sir.
Drug and alcohol testing from my drug court, when I sat in on some of those, they talked about how many drug tests they've had. How do you arrive at that? Do you spin a wheel of fortune to see on individuals, or how do you plan for that?
So, multiple levels. So first of all, what we plan for is we're going to talk about our risk and needs assessment. We identify high risk, medium risk, and low risk, and we have set standards. We also know at the time if somebody, because of our investigations, the types of offenses that they're under supervision for, we look to see if it is alcohol or drug related. If it's a theft case that's not related to alcohol or drugs, we probably won't be doing drug and alcohol testing. We also have, since COVID, we have a machine that we keep over at the Sheriff's Department that does some of the alcohol and drug testing as a pre-screen so that we don't have to collect as much of the UAs. We also have, sometimes we get information. So we have some high-risk individuals that we keep on a testing schedule, right, like drug court. But we also sometimes we have individuals call, and I'll go back to yesterday, I had somebody call yesterday and say, hey, my daughter is using, can you help me? I need to get her into treatment. And so we're going to do a drug test there and try and address it. So there is lots of different ways that you'll see we have typically about 1,400 people on probation at any given time, so we can't drug test all of them all the time, right? We have to use our risk and needs assessments to be able to address which ones we want to spend our resources.
Other questions?
Okay.
Thank you.
Okay, so rehabilitation. Like I said, to address, we need to do the short-term public safety, but our goal is to address the long-term public safety. How do we really help people make changes in their life so that they're not committing crimes in the future? Part of that is utilizing responsivity and professional alliance, developing a working relationship with these individuals so that even if they are in trouble, that they know that they can call and ask their probation officer for help. And that may sound really strange, but eventually a lot of these people really start to trust their probation officer and understand that their goal isn't to just arrest them. It's really to work with them and help them get through the process and make changes in their life. We identify the risk and the needs and the driver. What are the things that are driving people to commit the crimes so that we can backtrack and figure out ways to help them fix that. We're using motivational interviewing as a means to address internal motivations, because if I tell you to change, the likelihood is you're not going to change. Anybody who's tried to quit smoking or quit drinking or eat less or do all of those things, if somebody tries to force you into it, a lot of times that's not going to happen. So we're working with them to try and figure out how do we address that internal motivation so they see the benefits of that change. And what we're talking about is criminogenic needs, the needs of the offender that are going to reduce their likelihood of reoffending. We want to concentrate as probation officers on those things specifically. So our criminogenic needs, we can talk about those more in depth at some point, but these are really what we're trying to get at. These are the things that research has told us that really makes a difference in changing people's behaviors and reducing criminal offending. The antisocial cognition, antisocial personality, antisocial associates, and family and marital problems. Those are our top four, by the way, that make the biggest difference in changing offender behavior. Then we go down to substance abuse, employment, education, and leisure. So those are now the next part of what I'm going to talk about it really just has to do with some of the numbers we have in our what we supervise and how we go. Does anybody have any questions before I go any further into like the actual numbers of our office related to what probation does?
Any questions?
And I'm going to send this out to you.
Okay. Yeah, I was just, you maybe have told us, but, oh, sorry. I was just kind of curious, how many people does it take to run this for the county?
I think we're at 27
Okay.
for all my staff right now. I'm sorry, I
'Cause it
should
looks
know
like,
that
you know,
number off the
when you
top of
said
my head,
there's
but I
about
don't.
1,400 in probation, it's like,
Yeah.
wow, that's a lot.
It is, and then so when we look at this next slide, when you look at this slide, it breaks it down by felonies, gross misdemeanors, and misdemeanors, and I can explain that a little bit more in depth. But that's one of the reasons why it's really important for resource allocation for my department, that we really identify the low-risk individuals and the high-risk individuals. And according to the risk principle, if we put a whole bunch of resources into low-risk individuals, we actually are kind of wasting our resources a little bit. So we want to identify the medium risk and the high-risk individuals so that we can provide those resources. Because with 1,400 people, if I'm trying to see all of them all the time, it would be very difficult.
Yeah. Okay, thank you.
Okay, so this slide that I have in front of you right now, it talks about, this is by case. And when I talk about numbers, there's a couple things that complicate probation numbers. So I just want to have that kind of out there so that we don't, if you start trying to add, you don't get confused. We deal with individuals, but we also deal with cases, right? So one individual could have 7 open cases, or one individual could have 1 case. We also have, they have cases at felony, gross misdemeanor, and misdemeanor levels. So when we talk about how many cases a person has, is very different than how many individuals they have under supervision. So you'll see that in 2020, we had over 4,000 cases came through my department. You can also see not only have we seen an increase in how many cases in 2020, but we also have an increase in the felony offenses. So that's significant, understanding that we provide more felony supervision. Over the years, even over the last 10 years, our felony supervision has increased while our misdemeanor supervision has decreased. We're looking at supervising higher and higher numbers of higher risk individuals who have committed higher level offenses. So it's pretty important that we kind of differentiate those.
Commissioner Berg.
Thank you, Mr. Chair. Looking at the graphs, it's very interesting. And is there any explanation? It looks like it's fairly consistent or stable up until about 2015, 2016, and then it jumped practically 50%.
Yeah, since I wasn't here before 2015, I can't really even give you that history.
Okay.
I apologize. I don't know what the real difference is. Some of it, I would tell you that in 2020, when we look at this case statistic, it's very interesting because I can't explain that one, is our cases are higher than our individuals. So we're actually seeing a decrease in the number of individuals right now in 2021. Because we have so many cases pending in 2020, it actually, a lot of times we'll see some of those cases drop down once they go through the court system.
Okay.
I just need a little help because I can't differentiate the colors.
Okay, yep.
Here, so the number on the bar graph for felons, which one is that?
The higher one.
That's the higher one.
Yep.
So they go in this order then?
Yes, they do, actually.
Okay,
So
that
the
helps.
lowest level is the misdemeanor.
Okay, thank you.
Yep.
Interesting. Thank you.
All right, thank you.
Okay, so those are cases. Now we're going to talk a little bit, this is, like I said, these are, now we can look at individuals, okay? And we're looking at total number of clients, male and female, and then we'll talk about juveniles a little bit as well. But so you can see what I was just talking about, how the number of individuals we're serving right now is actually going down, even though their case numbers are going up. Now, when an individual has 7 cases, they are more work than the person who has 1 case. So it's not that the work is being reduced.
So, and maybe you were getting to this, but this seems a little incongruent with the effort to take people out of the incarceration and get them into community service or community corrections, that the number is actually dropping rather than going up.
So this rate, I think we will see it go up over time. When we talk about individuals, I truly believe this is like 2020 COVID. We have so many cases out there pending that it's going to take a while for them to get in through the system.
All right.
So only time will tell when we look at statistics, really how the whole last year and a half is, or year. Has
But it stands to reason if they take 1,000 people out of incarceration and move them into corrections, that the numbers would go up. But
So, and a lot of the numbers you're talking about are prison numbers and
Right.
supervised release numbers, and those are always lower than our probation numbers.
okay, that's right, we're on probation.
But we did take more people out of the prison system in the last year than we had in the past.
Thanks for that distinction. I was not dividing the two.
Yeah, and we do, and that's one of the things that people forget, but just as a reminder that our community corrections, we supervise everything here from juvenile all the way up to that supervised release coming out of prison. Okay, so statistical summary, and now I even need my glasses, the way it's set up. This is another one of those things of statistics that I want to make sure that we understand and we explain. So when I talk about total supervised cases, that is different, again, than number of a snapshot. So you'll look at this client statistical summary and you can say that I had 1,400 people under supervision on January 1st of 2020. Then on December 31st, I had 1,305. That doesn't include the fact that during that year, we had lots of people that came on probation or came off probation. So to understand the number of people that we had under supervision during that year, we're looking at the bottom number at the end, which is that 2,062, with juveniles included. You'll also see when you look at the juvenile numbers that we moved juveniles in and out of the system very quickly. We had just as many new cases as we had discharged. And so it's a quick turnaround because of what we talked about, wanting juveniles to be in and out of the system as quickly as possible. So we supervise a lot of people during a year. Okay. And then, again, this is just going by, comparing that total clients and offenses again. So you can see how the number of cases is going up, but the number of clients has gone down just a little bit. And then one last piece wanted to talk about, and at some point we'll go more in depth with this as well, but reminder of our community work service program. This is the opportunity for us, one of the best things we have in Candiota County, where our inmates and probationers are going out and doing community work service projects all the way through our county. And these are just a few of the projects they did last year. Between the cabins to the garden to just lots and lots of things. And they're learning new employment skills, they're giving back to the community, and we're saving our county money by providing some of these services and our nonprofits, so at some point. So that was my overview. I know I went through a lot of information really fast. Like I said, in the next couple different times that I come before you, my plan is to bring different staff in and we can go into a deeper dive into some of these things that I've talked about. But I wanted to give you kind of that broad overview of all of the different things that come in and out of the Community Corrections Office.
Well, thank you very much, and I'm going to ask the committee to perhaps the questions you might have may be answered when she gets a little more into the weeds, and because we need a few minutes for Jenny to give us a COVID update, we'll call it a day for you, Tammy Jo.
Thank you. Thank you for your time.
And thank you so much for the information.
Got it?
Morning, Ms. Lippert.
Good morning. All right, so quick update as how things are changing with our COVID-19 vaccination efforts. Last week, many of you know that the governor announced the openings of Tier 2 and Tier 3. This includes a lot of additional essential workers and then individuals who meet the lower age categories with some underlying medical conditions. Right now, really our focus this week for public health is on getting the food processing plants in our county vaccinated. So this week, we are getting 900 doses of of vaccine that we will give through public health. We are going to be holding clinics on Wednesday, Thursday, and Friday. Information has already been sent out to our local food processing plants to get those staff and those essential workers signed up first. However, with that much vaccine that we'll be having, we likely will be able to open up some of those slots to the public. So please, I ask anyone to watch for a media release, watch our website, our Facebook page, check local radio announcements for opening up some of those slots for individuals who still meet some of the other categories.
And they should wait till they see that announcement before anybody does any checking in or inquiring into it?
Correct. So what will happen is we will post on our website. People would go to our website and be able to click a link to then sign up for our open slots. So when in doubt, you can continue to check our website, because once we go live with it, anyone would be able to schedule their appointment, but we will also make sure that we announce it publicly, so those who don't continue to check would have access and know.
And when we say our website, we're not talking about Kaneohe County, although I suppose you can get it through there too. You're talking about the COVID website.
We are. So go through the Kaneohe County website, and then under the COVID, there's a drop down for a specific COVID-19 page, and that's where we post our information. Also locally, Caris Health, they have a number of clinics this week. We met with them yesterday, so be sure to check availability there if you meet one of the categories. And then also a lot of our pharmacies, our local pharmacies have vaccine to give. So definitely a good sign for us at the county. We're getting more vaccine, able to get it out into those individuals who are opting to receive the vaccine. Some data that I have to share with you, just so you can see where we are at compared to the state. Individuals across the state of Minnesota who have received their first dose of the vaccine, 1,260,771 individuals. That's 22.7% of our overall state's population. Second doses for the state, 724,692 individuals. That's 13% of our overall state have received both their entire COVID series. For our county specifically, first doses, we've had 9,525 individuals. That is 22.2% of our county's population. And then individuals who have received the entire series, 5,776 individuals, and that's 13.5% of our county's population. So we are right in line with the state. We're doing a really good job. We're receiving enough vaccine. We at Public Health are still only receiving the Moderna vaccine, so that requires 2 doses. Some of our local pharmacies and then Caris Health have a combination of both Moderna and Pfizer. We still do not have any Johnson & Johnson right now. That's the 1-dose vaccine that's been approved, but we anticipate we'll get that. The state's kind of saying maybe 4 weeks for allocations at the local level for Johnson & Johnson. Again, we'll continue to notify people via media outlets of when we have vaccine available. I would likely think it will be later this week, so stay tuned. One thing, we are seeing some increases in just our COVID positive cases. So just a reminder to folks in the community that we still need to be following the CDC and MDH guidance, masking, social distancing. If you're feeling sick, staying home, get tested if you're in question of maybe contracting COVID-19, because we want to make sure those numbers stay down even as people are getting vaccinated. I would be happy to take any questions at this point if anyone has anything.
Commissioner Gardner.
Thank you, Mr. Chair. Jenny, thank you for the report. You mentioned the clinic for the food processing plants. Many of the people who work out there are from our communities of color. I'm concerned about their families being able to access this vaccine as well. Any thoughts on that? What sort of guidance do you have for us today on that?
Yeah, so that's something that we're working on at Public Health. We're working with Caris Health to get a provider that we would be able to have some listening sessions in multiple languages. What we found is there's a lot of vaccine hesitancy with these groups, so we're really working hard on that. We've been in good communication with all of the businesses, so the food processing businesses, and they're helping to identify getting the messaging out and really trying to promote vaccine efforts amongst their employees.
Okay. Is there anything that we can or should be doing as a board to encourage people. I happen to have gotten my first shot last week. I'm entirely grateful for that being opened up. I was thinking I wasn't going to see that until about May or June. So I'm exceptionally fortunate, and I know how fortunate I am. But I do have this concern for those communities.
Yeah, I think just reassuring individuals, letting them know to, if they have questions, contact a physician. There's a lot of myths out there. I tried to touch on that last board meeting, but we're still coming across people maybe not opting in to this first round of vaccine, and then coming a couple weeks later once they have friends or family members or somebody else that they trust that have been vaccinated. So anything you can do to reassure the community that this is safe. It's gone through all of the correct channels of making sure that what's out there for the product is safe and effective.
Outstanding. Thank you.
Commissioner Berg.
Mr. Chair, thank you. Question or comment about the percentages. You know, we talk about 13%, 22%, and we're making good progress, and that's really great. Actually, I'm wondering too, the numbers are really better when you start, when we're talking about these percentages, we also have to take into account, am I correct, that like children will probably not get a vaccine at this point. So really, this is 13 to 22% of the total population, say 43,000 of Candy County. And you could take out another 20% for those. So we're moving right along. And unfortunately, there's going to be 20 to 30% or more people who don't believe in it or won't do it. And those are the people that we have to get to. And they're going to make a difference for our businesses, for us opening up, and everybody feeling better about that. So.
Yep.
Thank you, Commissioner Berg. I had the exact same question about if that included the people under 17 years of age.
Yes, I believe so. They're just looking at the overall county population and the state's population. So yes.
Thank you.
Good progress.
All right, if there are no other questions, we will adjourn the meeting of the Kennesaw County Health and Human Services Committee. Thank you all.